Okay, so Teledoctor is outside my home. Let's see what it's all about.
Hello, good day. I just stopped over to talk to one of my colleagues and he asked me about COVID-19. And I wanted just to say 2 or 3 things. As you can see, I'm wearing my mask. When I move around, and I do have my sanitizer actually. Let me do it actually to show you how it works. This is a Dettol kind of sanitizer I have. Very good. Put as much as you can actually, not just literally, as much as you can. Then you need to put it there. Bring your hand, try to actually spread it across all the parts of your hands in between here and there as well, and make sure even the thumb is also sanitized. That's the way to do it. And do it all the time, not just when you come from the loo or something, whatever place you go or wherever you touch something, make sure that you sanitize. Wash your hands as well. One thing that is happening in Zambia, and the public health specialists and people from the ministry have been saying, is that COVID is now spreading fast, and it's using those events that they call super spreaders. What are those? In Zambia, think about the funerals. When we are really nice people in Zambia, and that is a good thing. So when somebody falls sick, people run to their houses. But first, I would like to advise, ask a question. What could this be? In these times, that could be COVID. So imagine you rush to a household or to the hospital to see a patient, only to discover that that patient is positive for coronavirus. Then that is too late for you to change the course of the disease. So here's my advice. And sometimes we say social distancing, and this sounds very, very, very far. Here is the thing. If you hear someone is sick, it could be your close relative. Make sure you ask them if they have got any symptoms of COVID. And if they do have, for example, cough, fever, difficult breathing, the most likely at this point disease could be COVID. Let them go for testing, and if you are visiting them, why don't you meet them outside the house? Don't go inside the house. Wear a face mask as well before you see them. If they are in the hospital, do the same thing. Don't just rush there. Ask what could that be, and make sure that people get the tests. And if they do, you know the results. If it's positive, then you know what I've talked about. You sanitize, you make sure that you keep social distancing. It's possible to visit someone and let them come out of the house. You see them from outside. So that is actually this running to see some patients. And because you never know, and this has happened to many people, you never know that somebody has got COVID. You just rush there, and what would happen is that you get the disease. And by the time you go back to your home, you spread to other people. And before long, we have got a fire running through your families. And we have had families being wiped out because of COVID. So make sure that when you hear about a disease, think what it could be. It doesn't mean that you are a bad person. You just want to care for yourself, care for your family, and even care for the patient. I'm sure the patients would be very grateful that you protected yourself from them when they discover they do have COVID. I want to move on to another event which is very common in Zambia. This is the funeral. So this can result from coronavirus or other causes of death. And somebody dies, and what happens is that you need to go now to the funeral. And most people just go in church. The funeral is held in a closed door church, and then everyone gets exposed. And then in that funeral, we are so kind. All the women sleep in one house on the floor, no ventilation whatsoever. And if there's someone with exposure or with the COVID without you knowing, it means the whole group of people exposed to that person who has got those symptoms without even showing them, they would get COVID. And by the end of the funeral, which takes about 3 days, as many people would be exposed. And that's what we just don't want to say. Don't go to the funeral. We want you to be aware. Going for a funeral or a kitchen party where people meet together is really a recipe for getting COVID. But we are not saying we stop these things, but we say take precautions. In a funeral, why don't you sit outside, for example? Why don't you wear a face mask? Why don't you use what I used already, the sanitizer? Okay? And face masks can be anything. Others are disposable, others like mine here are cloth type. And make sure when you put those things, you put them well so that your mouth is covered, your ears here are hanging on very well, your chin is inside, okay? And then the nose, some of them have got some good clippers here so that your nose goes in. Guys, this is serious, because if you've got any other risk factor, some people don't even show symptoms. Others actually get very, very sick. They will need to go to the hospital. They need oxygen. Some need to be put on ventilators. And if people go down that route, most people die. And we want to prevent this. So it's a funeral, yes, we know you are grieving, but grieve with wisdom. Because after you have buried someone, we don't want to bury you next. We want you to be well. We want you to take precautions. So sit outside, even for church services. Why the heck do we have to have them in church? You can put the body outside and have a church service outside with speakers there. All right, at the graveyard, you do the same thing. You could even have services at the graveyard so people can sit on the side. Guys, this is serious. And for the people that take alcohol, I'm not blaming them. I think it's a common activity in Zambia. Maybe we are bored. People want to be active with something. But the point here is this. When you get drunk, you put your guards down. The same thing for HIV. We haven't talked about this a lot, but most of the acquisition of HIV for people who have been very careful is when they get drunk, they forget the condoms, they forget these other things, and they end up in a wrong bed and they get HIV. I'm not saying it's everyone. This is the same thing even with COVID. So before you are drunk or before you get drunk, you are quite aware of putting a mask. But when you get to that point where you get drunk, you forget about this mask. You forget about sanitizing. That's when COVID kicks in. Guys, it's not a worthwhile thing. You get drunk, you get a bit happy with 3-4 bottles, then tomorrow you got COVID and you die, and you say that you were happy. I don't think that's happiness that we want. We want you to take care. Take your bottle, drink from home, in an open place. Get if you want to drink, if that's really important to you, but don't go in a congested place. Are you driving? Again, that's another place that I see people like they're driving, windows closed, they're carrying someone. First of all, I would encourage drivers not to put people that you don't know into a car that you have just met on the streets. That's not wise, because supposing they are coughing, you won't know. I remember about a week ago, someone was just stopping me and I told them that I would have given you a lift, but I might be, myself, I might be at risk of COVID and I might give it to you. So that's how you take it, so that somebody is not annoyed with you. But the fact is that if you don't know somebody, you haven't lived with them, and to bring them in the car just like that, they need to put on a face mask. You need to open your windows. And there's no harm in finding out, do they have any symptoms of COVID? Ladies and gentlemen, one more thing. So I've heard from many relatives and friends that people are collapsing at home. I think you have heard this word, collapsing. What is collapsing? Here's the thing. With COVID, sometimes the signs are obvious, where you start feeling like fevers, coughing, and feeling tired. And then, by the way, by the time you are feeling that, it might be late. If you have got COVID, you could have even spread it before that time. But that's not my point. My point is this. Because of COVID, your lungs are affected in such a way that they can't take in sufficient oxygen. What that means is that if you are breathing and trying to breathe, if the exchange between the blood and the lung is compromised, it means that you are taking little oxygen. So there's what we do. We usually measure the oxygen in hospital. On your fingers, you have seen people measuring, and they say it's supposed to be 100% or just slightly below, like 95, between 95 and 100%, showing the amount of oxygen that you have in the blood. Now, because of COVID and the way it can compromise your breathing, the amount of oxygen in your blood can be lower. So if you put that pulse oximeter, and I would encourage as many people as possible to buy those even in home. You can use it at your home, put it on your finger, and it will tell you how much oxygen you have. Especially if you have got symptoms and you are feeling like difficult breathing, it can tell you where you are. So what's going to happen is this. You will know from the outset that your oxygen is at this level once you put it on your fingers. And then once you take it, it starts falling down, you will know when you need to go to the hospital. So if it falls below 90, going to 95 to 85, most people must be admitted. So it's something that we can do very simply at home. Put it in your household, have it around, especially if you've got somebody who's sick, and then you monitor them that way. If the oxygen is falling below 90, I would recommend you get in touch with the healthcare providers. And if it's really coming down to 80, between 80 and 85, you need to be in the hospital so that you can be observed critically and provided with support in case you need some special delivery of oxygen that is also given to you. I think I can already imagine people who are collapsing in the community could even have no symptoms, but the oxygen is being compromised and it's going down, and what you see, if it falls so low, they just collapse and die. I think we can do more to prevent those deaths. I'll end here for today and hope to see you next week. Enjoy 2021. This is your Teledoctor. Please get in touch with us through our Facebook page, through our app, the Teledoctor app, which is coming to you on Android as well as iOS. We want to hear from you. You can also call us to come and see you from your home or via video conferencing so that we can, again, because of COVID, obviously, we have to take precautions as well. You need your doctors to be alive. So we are taking precautions so that we are there. Remember, it's a mask, and remember to sanitize and take care. Enjoy 2021 and ciao for now.